all arthroscopic treatment of off-track Hill-Sachs lesions using fresh osteochondral allograft plugs. Rocks in a stream. Disclosures are listed at the bottom. Preoperative CT scans are performed to determine that a Hill-Sachs lesion is off-track with minimal to no glenoid bone loss. Shoulder arthroscopy is performed in the beach chair position. Viewing from the posterior portal, the Bankart lesion is identified. The glenoid is prepared, and the labrum is repaired with knotless suture anchors. The Hill-Sachs defect can be initially visualized from the posterior portal. The arthroscope is then placed in the anterior portal to view the Hill-Sachs lesion from above, and the defect is debrided of soft tissue remnants with a shaver. 2 off-the-shelf osteochondral plugs are irrigated, and their height is measured. The posterior portal incision is lengthened to allow for entry of the plugs. The incision is then opened with a clamp. The depth of the lesion is measured, and the defect is then drilled for the inferior plug. The guide pin is left in place and then over-reamed to the diameter of the osteochondral plugs. The depth of the lesion is then confirmed. One of the plugs is placed in a metal sizing guide. A T-handle reamer is then placed on the guide, and the plug is mounted into position, making sure to recreate the native chondral curvature as closely as possible. Care must be taken to orient the trajectory to recreate the curvature, as the natural tendency is to place the plug in a more flat orientation. Modifying the arm position is often needed to facilitate plug entry into the joint, as well as to optimize the entry angle of the plug. The steps are then repeated for a superior plug. Here we see the finished reconstruction from the posterior portal, showing that the top of the OCA plugs are congruent with the articular surface. These patients can be rehabbed according to standard anterior instability protocols involving a sling for 4 to 6 weeks with a goal of obtaining full motion followed by strengthening and a full release to all activities between 4 to 6 months postoperatively. The technique described in this video offers several advantages over other potential treatment options. It can be performed arthroscopically, it allows for the use of an off-the-shelf OCA graft, and it accomplishes our goal of not allowing the defect to engage while also not limiting external rotation. Together, the 2 osteochondral plugs create the rocks in a stream analogy, which effectively allows the glenoid to cross over the Hill-Sachs lesion during shoulder motion without falling into the defect. On behalf of Houston Methodist and all of the authors, we thank you for viewing our technique video.